Thanks for the great question. Like so many things in this field, the answer is complicated. The first complication is understanding or defining what we mean by fry, because that's a colloquial term. I'm going to assume from the context of current discussions on my feed that we're talking about psychopharmacological drugs causing permanent damage to the neural substrate, to the tissues of the brain. In that instance, the answer is yes. There are drugs like the neuroleptics that can cause some brain damage in specific situations. An example of that is a side effect called tardive dyskinesia, which is when you get a slow onset motor control issue, often looks like small twitches, usually seen in the eye first. And when that happens with these drugs, generally you want to take people off of them immediately. Non-psychopharmacological drugs like chemotherapy drugs are especially known to be high risk for causing some kind of brain issue. They're called neurotoxic drugs. They can cause damage to neurons. Now, in a broader sense, though, the drugs we usually talk about to help people for depression, anxiety, ADHD, like the stimulants, are not known for causing serious neurological damage. What often people refer to is the negative effects of the brain adapting to having the drug on board because the brain is an incredibly plastic, adaptable organ. It changes in response to the environment constantly. That's where memory is argued to come from. And often we want to make those changes, right? There is an argument that the reason some drugs take 4 to 6 weeks to work is because what we call working is the brain's response to having that drug in place for that time, as opposed to the drug itself actually creating the desirable effect. So adaptation is not frying, it's not damage, it's just change. But some people find those changes to be undesirable. And we call those side effects because the only difference between a main effect and a side effect, and I'll talk more about this in another video later, is whether we wanted the effect to happen or not. So, to your question again, yes, there are drugs out there that can cause brain damage that are neurotoxic. More often, what we're really talking about when someone says, I feel like my brain is fried, is they did not like the response they had to the drug and have maybe perhaps chosen to stop taking it because they prefer the state they were in without the drug, and that is okay. That is a fair choice. I hope that answers your question, but if there's anything more I can clarify, post in the comments. Don't forget to like and follow if you want more of this content.